In 1999, I had the North Carolina Medical Board visit my office and ask me for random charts. Now, of course, being naive at that point and being above and beyond, practicing medicine above and beyond the standard of care and being involved in teaching certain types of concepts and certain types of theories and certain types of treatments to the medical profession throughout the country at various courses, I had nothing to hide, and so I just let the medical board, whatever they wanted, I kind of gave it to them. And I did this because I thought naively that the medical board was only trying to do its job, and they didn't understand, so they were just looking to ensure that there was nothing that was going on that may be harmful to patients. And because my thought process at that time was that the medical board is only looking out for the interests of the patients, I said fine. Mind you, there was no complaints. There was no complaint from patients. There was no complaint from insurance companies. There was no complaint from other physicians. There was no complaints about anything. The medical board just randomly came in. Now, this goes on for about a year, and then we find out that in North Carolina there are a number of other doctors that are kind of getting the same type of scrutiny, and yet there have been no complaints against them. And the medical board is just going through this own process, their own method of trying to find out what people are doing and why they're doing it. Then we started finding out that doctors are being brought up on charges. Doctor being brought up on charges for administering B12 shots, doctor being brought up on charges for recommending probiotics to their patients. Just absolutely ridiculous things that we couldn't even believe was possible. So some of the doctors in North Carolina that happen to be more open about their integrative practices decided to call together a meeting. And this meeting took place, and we came to realize that there were a number of us that were being scrutinized and ostracized for no reason, for no apparent reason. There was nothing that was wrong, and yet the medical board was targeting us. So we decided that the public needed to know about this, and we got a lobbyist, and we actually passed a bill in 2003 called the Due Process for Physicians. This bill was to show that doctors were being scrutinized and being segregated into certain groups. And the North Carolina Medical Practice Act, by statute, already stated that doctors could not be singled out for their practice of medicine, their philosophy, for their theory, for the type of tests that they did. Yet we were, and it was actually being aimed at those doctors that were doing heavy metal toxicity testing and treatment. So we started this process, and the long and the short of it is that when I testified in front of the North Carolina Congress, the North Carolina legislature, only 22% of the House was in favor of this bill entitled Due Process for Physicians. And all the bill was is saying that all doctors should be treated evenly. Just because they're doing one form of medicine versus another form of medicine, they shouldn't be ostracized, or they shouldn't be treated unfairly. It's no different than saying that a man can be treated this way, but a female should be treated differently, or a person of African American descent should be treated differently than a person of white descent. It was no different than that. It was an issue of civil liberties is what it came down to, that all doctors should be treated equally. So we started this process, Due Process for Physicians. We introduced the bill, and 22% of the House was for us. 78% of the House was against us. Now, I won't go through all the details and what happened, and that's probably material for a movie, so I won't give that away right now. But essentially, after I finished testifying in front of the North Carolina legislature, the vote went 106 to 6 against us, 106 in our favor versus 6 that were against us. And what's important is that this was a monumentous victory because the House was actually against us until I testified and explained to them what was going on. I did that in the capacity as the president of the North Carolina Integrative Medical Society. So the legislature got the picture. They understood what was happening, and they agreed with that what was happening was unfair, unjust, unright, and made a definitive change in the law. What's interesting for those that are listening to this is that is the fastest law ever to have been passed in the North Carolina legislature. We got that bill into law in 3 months. So it passes the House, goes to the Senate, and passes the Senate. And I believe the vote was 42 in our favor to 6 against us. Now what's most interesting is the 6 people that voted against us. I bet the viewer would never guess who the 6 people were that voted against the bill called the Due Process for physician's bill. It were the only 5 people that were serving in the North Carolina legislature that were doctors and 1 that was a dentist. The 6 people that were in the healthcare profession voted against the bill that gives fair rights to all doctors. Why is that? Why is that? It's because they were trying to protect the status quo, because they do not want doctors to get a fair trial or fair representation unless they are part of the good old boy network and it's furthering their own cause, unless they are still maintaining their own monopoly. They don't want anybody to come in and change the system and get better health in the patients, because if they do, then they lose out because the patients won't go to them anymore. That's what it comes down to. So we passed this bill, the fastest bill in the history of North Carolina, and we think now that we've done something good for not only ourselves, but for our patients, and that was our biggest motivation. Within 2 weeks of that bill having been passed, and only 4 days after I was named as one of the top 50 doctors in the United States by Dr. Stephen Sinatra and Phillips Publishing and Healthy Directions LLC, three different organizations or 3 different components that rank me as one of the top 50 doctors in the country. 4 days after that, the North Carolina Medical Board sends me a letter